Acute angle closure glaucoma. This is something we see when the outflow of aqueous humor is obstructed. Often patients will present with a mid-dilated pupil, a red, painful, irritated eye, some decreased visual acuity, and then sometimes nausea or even vomiting or headache. Often it occurs when patients walk into a dimly lit room, and the pupil dilates, and that causes the trigger of acute angle closure glaucoma. On physical exam, you may see a slightly steamy cornea, that mid-dilated non-reactive pupil, and if you measure the intraocular pressure, which I highly recommend you do, it will often be elevated, sometimes very high, over 50, and normal is around under 20. The first thing you want to do is decrease the aqueous humor production. You can do that with several medications: a beta blocker like timolol, apraclonidine, which is an alpha-2 agonist, or acetazolamide IV. You can also help increase the outflow of the aqueous humor using pilocarpine drops, which are miotics and help open that space to allow the aqueous humor to drain. In severe cases, especially with very high intraocular pressure, and in consultation with ophthalmology, you may even need to try something like mannitol IV.